Hello, Amp Honors Program. I'm back from my car in my garage for my second day of clinical apprenticeship. Today got a little more involved, and I actually got to see some patients on my own first before my preceptor came in and did the rest. So that was exciting. I felt like a real doctor for a little bit there. I can't get ahead of myself, but it's always exciting. So the most interesting case today was actually the first one, and I was able to see him on my own first, so that was kind of cool. It was a 30-year-old guy with a couple just kind of more chronic complaints. He had a rash that he had noticed on his right medial shin and also his left posterior ankle, and then he also had some kind of chronic like loose stools. So we talked about both of them, and the rash was a little bit, so it was macular with scattered papules and some scarring and discoloration too that had been there from previous rashes. He had been treating it with some topical steroid cream, which had been helping, he said, but it just kind of looked like a lot of the scarring and discoloration was kind of like a banana bruise. That's almost the appearance that it had. And then there were some more red spots, some newer spots of rash. And he said that he has trouble avoiding picking at them, and I think him picking at it is kind of what causes a lot of the scarring and also the spreading of the rash, because he noticed that it started small, but it's gotten to be a larger area on both spots. And then with the loose stools, he said he's been having to go 5 or 6 times a day. Most of them have been loose and kind of watery, liquidy. And I didn't have a great answer for it. I asked about his diet and stuff. And he said he doesn't get a lot of water, which kind of is counterintuitive. But my preceptor thought that maybe there was some stool occlusion in the bowels that was kind of causing the stool that's actually coming out to be kind of leakage or like more liquidy in nature. And so it's actually the constipation in a way that's causing the diarrhea, which is kind of an interesting thing that I definitely didn't think about right away. Well, the preceptor also thought maybe just irritable bowel syndrome or something like that. But to check out his abdomen, we got a KUB scan, which is a kidney, ureter, and bladder scan. And it's basically just an x-ray of the abdomen, but it's slightly different than an abdominal x-ray, just in its positioning. He said it's a little bit better for viewing of the bowels. And there did end up being some moderate like bowel and gas obstruction. My preceptor prescribed a laxative, which is actually, why would you prescribe a laxative with a patient with diarrhea? But in this case, the constipation was maybe causing the diarrhea. So he thought if we can just flush out the bowels will kind of have like a reset, and then hopefully they'll come back to regular. So yeah, that was the coolest case on my second clinical apprenticeship day. No clinical apprenticeship next week, sad, but I'll be back at it in 2 weeks, and I'll hopefully be back to you guys with more.